Boom, we are recording and we have a few more people joining us. So again, welcome to Virtual Presentation Week, day 2, 11 a.m. And you're in for a really awesome treat with some great information about brains. It's just fun to say it that way. I know, Dr. Culler, you're going to correct me 100%. So, but it's going to be a great information. She's got a lot of information, so I do not want to detain her. But we do have to give a special shout out to our sponsors, because if it hadn't been for them, we would not have had this event. So I want to thank Virginia Assisted Living Association as our supporting sponsor, and Senior Living Guide as well. And then our exhibitor sponsors are GenCare Senior Medical Center, Bayada, Aegis Sciences Corporation, Commonwealth Senior Living, Carlton Building Services, Comfort Keepers, Morrison Living, Prime Plus Senior Center, Mako Medical, and National Physiatry. And we do have somebody from National Physiatry here today. Our silver sponsor, Next Chapter Services of Virginia. Our gold sponsor, Caption Call, which you'll hear from in just a few minutes. And then Anthem Health Keepers is our keynote sponsor today. So just want to thank them and give them a round of applause, a sign language applause, for being our sponsors for this. And I will be quiet and let Caption Call, Stephen Damari and Lisa Monisher take over.
Hello, everyone. I am the Virginia Area Caption Call representative and also the outreach chair for the local Hearing Loss Association chapter. And we are so pleased to be here once again to share information about this wonderful program to help professionals like you be able to better serve your clients that have hearing loss. Dr. Culler's presentation today kind of correlates with some of the things that our resident audiologist, Steve Damari, will cover as far as hearing loss and dementia and cognitive issues. So I'm going to turn it over to Steve to share a little bit more about Caption Call and their wonderful program that can better serve those in your communities.
Thanks, Lisa. Thanks, Micah, for having us, and I'm looking forward to Dr. Culler's presentation. Yes, I'm Steve. I'm an audiologist. I'm the staff audiologist and director of education for Caption Call. And to give you just a quick rundown a little bit about what we do. But first, some of the statistics about hearing loss and why we're here. Approximately 30 million Americans suffer from hearing loss. It's 25% seek help. So there's quite a few people out there with undetected or untested hearing loss. So quite a few people with a hearing issue, and a lot of them wait a long time before they actually do anything about it. There's a lot of data out there now to point to hearing loss and its effects on folks' social anxiety and isolation, cognitive decline, dementia, higher risks of falling, and other health comorbidities. So it's one of those hidden types of issues that really needs to be addressed more and created more awareness. A recent study of 14,000 individuals. This is a market track study. Of those folks surveyed, they pointed out that talking on the telephone was the #2 situation that was the most difficult, it's most important to them, and the most difficult situation to deal with, especially with hearing loss, second to one-on-one communication. So talking on the phone, especially during this pandemic, has been very important to stay connected, especially when you consider that these folks need to stay connected to their MDs, caregivers, family, friends, and other services. NIDCD out of Washington, D.C. estimates 1 in 3 people in the U.S. between ages 65 and 74 have a hearing loss, and nearly half over the age of 75 have hearing difficulty. So age is the strongest predictor of hearing loss among adults. 91% of adults with hearing loss are age 50 and older. So quite a few. So once you hit 50, that's probably a good time to get your hearing tested. And those older than 80 have a more severe hearing loss as you get older. Adult men in their 50s are 3 times as likely to have a hearing loss than women of the same age, and then those numbers get a little bit closer as we all age. So the bottom line for this topic is if you suspect a hearing loss or think someone has a hearing loss, the best thing to do is contact your hearing care provider or audiologist to get a comprehensive hearing evaluation as a baseline. And just so you know what we're in business for, we are a business, but we are regulated by the FCC very strictly. We follow very strict guidelines based on the captions delivered. So that's how we are benefited, is by captions delivered. So everyone's phone bill has a little surcharge, and that's where the monies come from, the government program. And so the eligibility for this no-cost program is that the individual has a hearing loss and has difficulty talking on the phone. And then, as always, if the person doesn't want to use captions, they can easily turn captions off and contain that privacy. But we follow strict privacy guidelines. Also, internet creates a much better signal, much more accurate signal. So internet is required. However, if there are folks that don't have internet connections, we can provide that through our phone. We can provide an internet solution so we can supply the captions accurately. And then as far as certification, any professional can certify their patients. So professionals within the senior living communities can certainly certify patients to receive this service. And then we'll outreach to you, the facility, or to the patient directly if possible, or to their family members to arrange for installation. And we do follow CDC guidelines for PPE, so we're very serious about that. If we do come into your home or a patient's home or a nursing facility, we follow PPE guidelines. And then the phone itself, as you can see, I don't know if you've seen the motion display here, but the phone is very easy to use. We'll set that phone up for you. A couple features on the phone that are very helpful is the hands-free speaker. So this way, with people with hearing aids or other things where they need hands-free, they can hit hands-free, have the speaker on the phone going, be able to read the conversation instructions. They can save those instructions as well, read them back later. So that gives them a hands-free modality, which is very convenient. And then for some more sophisticated users, or even in those situations where they want to be mobile or even go out to a courtyard, we can combine our captioning service via a caption call app to a mobile device, whether it's an iPhone, an iPad, or an Android. So we're compatible with all those platforms. That's 30,000 foot view of caption call. If there's anything that you need from us, please reach out to myself or Lisa, and we'd be more than happy to help. And we really appreciate you giving us the time today. Thank you.
Thank you, Stephen and Lisa Modeshert. I appreciate it. And I love that caption call is so convenient and it's free to the seniors as well. That's awesome. So thank you so much for you both and for being our gold sponsors for this event. Now, for the much awaited Dr. Culler, which I am really excited to have her speak today. She's going to be sharing her screen, which is there. So thank you, Dr. Culler. And I will now let you take over.
It helps when I unmute myself so I can start to chat. Thank you so much for having me today and for everyone for joining this morning. Here is what we are here to chat about today. So I hope there is something that is of interest for either you, yourself, someone you care for, a community that you support. That is essentially my overarching goal for you today. When we are talking about brain health, the brain, lifestyle, and dementia. I like to say my background is in the behavioral sciences. So I study in behavioral health, psychology, sociology, and gerontology. I identify as a social gerontologist, which means I help people live healthy, independent lives for as much as possible that they can. And so that is my perspective when I come into this type of topic, as well as my training and my approach to discussing brain health, lifestyle, and dementia. I'd like to disclose that at the front end, and you'll understand why when we start to dive into this topic. When I discuss this, I will also try to provide you some information as well as where we're at in the field, as well as where we might still have some differences as we move along. These were the objectives of the things that we were going to discuss today. So I'd like to lay a little bit of the basics around Alzheimer's disease and its related dementias, discuss some concepts related to the brain, that fall in under this umbrella, maybe some of the myths of aging that have helped or hindered, either way, this discussion and where we're currently at in the field, and talking about risk factors, lifestyle, and brain health. And I'm hoping this will leave us with some food for thought of where we can move forward and where we're currently at today in some of the research. It's a lot to tackle in about a half hour, but I'm going to do my best to give you at least the oversight of all of the landscape. And I want to honor time at the end for your questions. So as your questions come to mind, please go ahead and drop them in the chat. So as new information comes in, you don't have to hold on to your question. That's what the chat's for. And my good friend Micah is going to help me out with that later at the end. So to start, many of us may be familiar with what dementia is, but I just want to lay the groundwork. It is a term for a broad category of symptoms related to the brain, our thinking skills, and our abilities. It is, the last I heard, over 110 different types of diagnoses can fall under this dementia-related umbrella. The most common one that you will hear is Alzheimer's disease, which we're going to move forward with. But each diagnosis has its own pathology in the brain, distinguishing features, and it's related to abnormal brain changes, decline in our thinking skills, and not only does it impact our brain abilities, but it influences our behavior, our feelings, and our relationships. And for many of us, this may hit home as we know someone that has lived with some type of dementia, we're caring for someone, or we're involved in some level of care. And one of the first signs that we tend to see for individuals with dementia comes with financial planning, short-term memory, forgetting things that we would typically know, like our appointments or ways to get home. But those are just some of the warning signs. And I just wanted to show this again as a reminder that there's many different types. Some are related to chronic health conditions and have their own distinct pathologies like Parkinson's related dementias, and others, the most common is Alzheimer's disease, which is where we're going to focus a little bit more of our discussion on today. And we know that the dementias are progressive in their nature. We talk about them in terms of a continuum, and this will be important as part of our lifestyle discussion and brain health. And what does this continuum mean? And we talk about things in terms of a timeline. And this is very individualized, although on average, we have some idea, depending when people get a diagnosis, how long they may be in these certain stages, and knowing that it's going to progress at some time. But to think about this continuum, things may start slow, and as it progresses, symptoms will worsen over time. But to keep the idea of the continuum in your mind, because this is going to be important when we start to talk about brain basics and the brain health and lifestyle, is this buys us time along this continuum for disease progression. I think it's important to note that some of the statistics that we're seeing in a lot of the conversation of why we're talking about delaying the disease for Alzheimer's disease, just by 5 years, is so important. This is from the Alzheimer's Association's report on changing the trajectory of Alzheimer's disease by 2025, and their research on saving lives and dollars. So if you just look at that dark solid line up there at the top, that is the current course that we would be on with statistics and projections. If we were to delay the onset of disease, Alzheimer's disease, by just 5 years, that bottom dash is the impact that that could have. So if you're looking at in terms of numbers and outlook, by just 5 years, 2025, all the way out there to 2050, that's the impact it could have. And so that's where we're hearing about delaying the disease, Alzheimer's prevention, as part of our narrative. So what would this actually look like? We're talking about 5.7 million people without Alzheimer's disease over that. And so you could see how big the circle is and how little that gets by 2050. It's a difference of 5.7 million people, roughly a 42% change. in statistics by just 5 years of when we can onset the disease, and a difference of $367 billion of care in our current healthcare structure, which we know we need policy and advocacy change. That's another conversation for a much longer talk, but it helps to give you some of the ideas with the numbers. And we know that this is very important. In my last slide, I just want to bring it home. I was seeing we're all in some different areas, looks like mostly on the East Coast, but think about what this would mean in your state, in the communities you serve, and those that you work with in terms of statistics-wise. Hopefully this will give you an idea looking at just the shade of the color of your state. Looks like many of us on the East Coast, we're in some higher numbers, typically serving older adult aging populations, but this delay of just 5 years can have a big impact. And this is where we begin to enter our brain health and lifestyle discussion. So to do this, I'm going to start with what I like to think is the terminology that is used when we're talking about this. I don't want to get too scientific, but I want to lay the groundwork on the basics of what we typically hear, and also some of the myths of aging we've had to overcome. So if you've heard about neurogenesis, this is our brain's ability to generate new cells. It was a common myth of aging that this was only for younger children. We find this still happens for adults well into our 90s, even in our hippocampus. So that's the area of our brain strongly related to memory. And we still find this happens for individuals that have Alzheimer's disease. They have the ability to generate new brain cells, different parts of the brain from a function of different activities. And so it's something that is really with us until we are no longer here on this earth. And for me, I think that's an exciting part of brain science and research is we keep coming out with new findings to debunk some of the things we thought we knew previously about the brain. And it's helping us better understand how we can design programs, how we help people live better with brain-related diseases to improve their quality of life, to improve how they move about in their environments. And that leads us to neuroplasticity, which is our brain's ability to adapt and change. The other myth was we thought this was also for the youth and younger people. For again, this is for us lifelong. So this comes from our cumulative experiences, from the way we live our lives, from the time we are younger to the way we are currently doing, as well as the things we're going to do in our future. Environment, things we're exposed to, the things of how we choose to spend our time, all of those things come and play into our neuroplasticity. And our brain is constantly adapting, changing, and reorganizing. And this is where we tend to say we want to get the bang for our buck. We invest in lifelong learning. And my best way to show you this is I apologize, is I'm Italian and I go to my hands. So if you were to think about this when you're doing things, your brain is constantly learning. So as you're doing that with your fingers, if you think about it this way, you're creating all these different neural pathways. And you want to keep doing that. So if you lose a couple, you still have ways to retrieve it, whether this is a memory or a skill or a function you know how to do well. That's the idea of neuroplasticity. So you keep just building up more. Now, imagine I have more than 5 fingers, so you can access those things. It's the combination of neurogenesis and neuroplasticity. And that leads us to cognitive reserve, is as we build that more integrity and structure in our brain, we can lose some things over time and still access what we want to. That same point, which we're going to say is my arm right there. That's what we want. And that's what we do through our constant exposure, the challenge that we're living through our lives, the activities and what we're doing to engage our brain. So our cognitive reserve is essentially our bank. It's our protection against the development of damage to the brain. So if you think about it in terms of those silly fingers I had, but it's my simplest way to show it, you can still access things in multiple ways. And it's okay if a few things prune. Our brain does do some pruning over time if we don't use some things, but we can quickly reactivate some things as well. that analogy of if you learned how to ride a bike, it can come back to you if you haven't done it in a while. There's certain things you can pull out, but other times what we're seeing when there's neurodegenerative diseases involved, there are damages to those pathways and they no longer exist. But what happens is our brain works like a GPS. We reroute, we find other ways around until there's mishaps that aren't working for us. And that's our brain reserve. And so I'll show you a bit of what that looks like in a picture form. What we find though is people that have higher brain reserve can have damage to their brain. We could take a picture and we could see pathologies of dementia or other related diagnoses, and you be asymptomatic, meaning you're not actually showing symptoms of the disease because of that high brain reserve. But on the flip side, people that are lower with brain reserve would present their symptoms earlier in life. So I like to have that picture of the puzzle is these three key terms all kind of come together around the conversation of lifestyle and dementia risk reduction. All of these are a lifelong process. It's not something that happens overnight. It's an investment in ourselves, in our brains, in the things that we are intentionally doing, and the things that we still can continue to do with the diagnosis, whether it's a chronic health condition, an acute health condition, or a brain-related condition as well. Maintaining the lifestyle factors that we will discuss can still add improvements to our brain and ideally help us maintain for some time. So why this huge conversation? It has been online for a while that the lifestyle factors, the way in which we live our lives, come around the conversation for dementia risk reduction. Up to 40% of global cases of dementia could possibly be prevented worldwide through 12 lifestyle factors, which we're going to discuss. But I want to give the caveat here. If you are reading anything outside of the United States, you will hear them say, in one way or another, we can likely prevent dementia. They'll say dementia prevention. Pretty clearly, World Health Organization, most things out of the UK, as well as Asia. The United States, we're not really comfortable with that language just yet. We want more evidence. We will say we can reduce our risk for dementia. So I just want to point that difference out. You'll hear slightly difference in language depending where you're getting your source of information, but we are talking about the same thing. Focusing on lifestyle factors that you have control over in your daily lives that can have some reduction in your risk for dementia, as well as other chronic health conditions throughout your lifetime. So what are those 12 risks? The Lancet Commission convenes itself roughly every 3 to 4 years and pulls together somewhere between 20 to 30 different experts to look at the latest evidence that supports modifiable risk. They did that this past summer and released their report. This time they came out with 12 factors and they added 3 new ones. I will ask you to please not have to squint to look at this map. I'm going to blow it up for you in the next 2 slides. I just wanted you to show they look at it as a life course perspective. So some of the factors are more important early in life. Some play a role more so in midlife. Others are important to pay attention to in late life. But essentially, we know they're all things we should be doing throughout our life. There are 3 new factors that they focused on in their 2020 report was excessive alcohol consumption, which means more than 21 units per week, which if you ask me, that's pretty generous. Our US recommendations are 1 drink a day for a female and men get 2. So they were pretty lenient there on units of alcohol. Avoiding head injuries or recognizing the role that head injury can have in later life brain issues, and the role that air pollution can start to have in our brain health and our wellness. And I want to point out the 2 risk factors that came online in 2017, and we have great synergies with Caption Call being our sponsor. Hearing loss came online as saying it's a risk factor for dementias, as well as one that's preventable, because we can screen for hearing loss and we can treat it. It does mimic cognitive decline. We heard about that. But the big one too was social isolation, realizing how important that is for our overall health and well-being. And that has been at the crux of a basic definition of our health from the World Health Organization since 1946. But really realizing how important it is that it plays a role. So now I'm going to blow up this map for you so you don't have to squint here. If we were going to walk through this just quickly, you want early education in life, as much education as you can. As you move through middle life, that's where you're focusing on hearing loss, protecting your brain, monitoring hypertension, alcohol consumption, and obesity. When you get to later life, smoking, watching depression, social isolation, physical inactivity, air pollution, and diabetes. And if you were to take that path and wind it all down throughout your life course, that gives us the 40% of modifiable lifestyle factors that we have in our own hands. One of the ways I like to summarize this when I chat with other people is this. I find it a little easier. I combine this with a meta-analysis that was done by you and colleagues. And they looked at over 150 randomized controlled trials, and it was published in August of 2019. Their risk factors overlap a lot with the Lancet report, but I find it easier to think if we were going to map ourselves from head to toe, so brain and body, and then we put ourselves in our environments, what's the risk factors we want to think about and make it tangible to ourselves. So let's think those through now. Here, we started with education. You want as much education as you can as early on in life, and you want to maintain being a lifelong learner. One of the things we have currently in our research is we struggle with finding out exactly what that measurement is, because we typically on a survey, we ask you how many years of formalized education have you had, and that's our measurement. We realize we need more because lifelong learning is formal and informal. Many of us seek out new education like what you're doing now, and hopefully you're learning something new. I'm going to go out on a limb there, but I'm hoping for that. But you're involved through learning new things in your daily life, navigating around your environment, continually doing things through your work, your volunteer work, the multiple roles you have in your social networks, being a part of boards. All of those things are learning that we don't necessarily capture in research, and we know we have to do better at that. But we know we need education, and we know we need lifelong learning. And we know the opposite of that is not being involved and not stimulating our brains. And so that is constantly what we need to be doing. The other thing we know we need to do, and unfortunately we tend to get this message when we're younger, is to protect our brains, wear a helmet. We need to remember this across all ages, to do anything that can protect our head from injury or trauma. So keep those things in mind. Focus on sleep. That's a myth of aging. You need less sleep as you get older. Going to let that one sink in for a moment. Focus on sleep. It's important. If you're not getting proper amount of sleep, reach out to a healthcare professional. Sleep is vital to your brain and body and can cause a lot of different issues if you're not getting proper amounts of sleep. We want to monitor our mental health, especially depression and low mood. It's another thing you want to reach out to a healthcare provider about. Great impact on your brain health, as well as a strong relationship with dementia and Alzheimer's disease. Hearing loss is on there, so covered all the things in the head. I mentioned stress last because stress, I believe, is full body. It goes from head down to the body. But we want to be able to relax our mind and monitor daily stressors and avoid chronic stress, because this can really impact our brain health and our overall health and well-being. And now when we're thinking about our body, so we move from brain to body, chronic health conditions that we hear a lot about in relationship to Alzheimer's disease and other disease states later in life, your heart health, manage diabetes, hypertension, watch your weight. You hear a lot about waist to hip ratio in relationship to your brain. You want to monitor that. We know about smoking and alcohol. Shouldn't be smoking. Monitor alcohol. This one was a little lenient with 21 units to drink, but it's also one of those things, if you're not drinking alcohol, there's different reports out on if it's beneficial to your brain health. What I can say now is it's likely something people aren't going to tell you to take up as a preventative measure for your brain health, but things in moderation for your health and well-being. Work with your healthcare providers. And I like to end on the one that's down there by your feet for intentional purposes of engaging in physical activity. People that are inactive, aka couch potatoes, are grouped with cigarette smokers as taking their lives into their own hands, meaning you know the risk. There's enough research out here now to help us understand that we have to move. And the way I like to help people understand exercise is we don't have to think of people out there running. Movement looks different in many ways. If you've ever cleaned your house or done yard work and you're tired, you know you've exercised. So find an exercise and ways to naturally move your body that you can maintain. And then just try to add a little bit more. The government recommends pretty much universally across all countries 150 minutes of aerobic activity a week. What they mean by aerobic activity is something that gets your heart rate up a little. And then 2 days of strength training. So something that can help you tone your muscle strength will help you, especially everyone of all ages, to help maintain muscle mass as you get older. So we've covered the brain health risks for brain and body. Now we put ourselves in our environment. Air pollution just came online, as well as exposure to secondhand smoke. So avoid or reduce exposure to your secondhand smoke. And then social isolation. So I'm going to link this one to smoking. If you're socially isolated, it is very similar as if you were smoking 15 cigarettes a day. That's like over half a pack, I believe. I don't really know how many cigarettes are in a pack. I probably should look that up, but I would say I'm pretty sure that's close to over half a pack a day. But if you were to think about that, you can realize that's detrimental to your health. So finding ways to stay connected with other people is vitally important. One of the things we had found before, even before this came online as a risk for our brain health, was the concept of staying socially engaged to others can help delay dementia progression, could currently exceed that of FDA-approved medications for Alzheimer's disease. So the effectiveness of actually groups of people staying socially engaged could show great impacts in compared to our medications that we currently have available. So how important is that for individuals with dementia as well as ourselves for our overall health and well-being if we were to think about that? And this was pre-COVID even. So even more important now. So why do we talk about all these lifestyle risk factors and I tell you about those signs and bring it all together? I like this image from Sharp Brains because it helps us, I think, a little bit understand. So that black line at the bottom there would be our typical aging curve. I like to think about everything we just talked about, and I know it was a lot in a condensed amount of time. If you were to be doing those lifestyle factors and essentially growing your new neurons, making your brain more flexible, building up your cognitive reserve, that's the distance there between that black line and that gold line there at the top, ideally, is what you're building for yourself. And for many people, what we're seeing now is that is if you were to develop some type of brain-related disease, 7 years of onset before you would show symptoms roughly is about the hallmark number of the recent research that I've read. So you would have roughly 7 additional years before you would show some symptoms. So the way I've heard other people explain that to me is that 7 years of doing the things you like to do, your quality of life and other things. And for other people, we've known they've lived their whole lives and we didn't find out they've actually had pathology for brain disease until we did autopsies after they donated their brains to science after they passed away. So it's very individualized. It is still not a perfect science, but we know that doing these lifestyle factors can impact our brain and overall health and well-being. As you saw, it's related to many other health conditions of what we are doing. And so I hope that helps kind of show you how it's adding up for yourself, for your others, for those that you're caring for. And some of this is not new. I wanted to just put this slide on here as there's multiple conversations that have been happening and have been around. And we have been seeing decreasing prevalence rates. So when we're talking about prevalence rates, it's the number of people with a given disease at a specific time. And so we are finding groups here in the US that we have been studying for a while where they're having less occurrences of dementia now, and we've been following them over time. So it is giving us hope that the way in which we are living our lives, the advances that we're having in our health, how we're better controlling some of our chronic health conditions is having an impact on our brain and our brain-related diseases. And Framingham Heart Study is one that is very well known, but we're seeing a decline in dementia for over 30 years from that. And that's one of our longest research studies. We have a new study coming online at University of Center for Brain Health of Dallas, Texas, that will actually bring on new people to just study what happens when they actually do these brain health interventions and we follow them over time. It will take a while before we have that data, but to actually hone in the lifestyle factors. We have the Worldwide Finger Study looking at multimodal lifestyle factors and seeing how that actually has an impact. But I wanted to show you, we have studies from 2000 to 2012 showing a decrease in some of these prevalence rates. And this was from our health and retirement study here in the US. So we're seeing little glimpses where things are having an impact. We don't necessarily know exactly what specific tangible factors there are. We know it's related to lifestyle. It's typically the biopsychosocial factors. So what people report in saying their level of education is, how they're spending their time, the foods that they're eating, the groups that they're involved in. So it tends to be the ways in which we're living our lives. So I wanted to just put this up here to show you, we have been seeing these trends in little pockets in different studies. So when you're hearing these different stories, it pops up on the news, it pops up in media, in newspaper coverage, we're finding it in different ways. We just haven't exactly pinpointed exactly what it is, but we're starting to get closer and we're having a better understanding. But what we do know is how we live our lives is very powerful. So I wanted to just show this of why your brain health matters. Brain health is important to most Americans. Brain health has become a common terminology for us here in the US. It's our second most ranked top health concern under heart health. We recognize that it is important for us to acknowledge our brain health, but most of us in the surveys, I should say, aren't really sure what to do or how to maintain or improve our brain health. Many people are reporting having a fear of decline in their brain health in the future. And so I won't be surprised that you'll hear about brain health and lifestyle for a while. There's a lot of work that we need to do in this area to help people understand about their lifestyle, how what they live impacts their lives. And most importantly, I just want to point to the circle that you're seeing. Our lifestyle is 90% of our brain health. That is what we have control over of what we're able to do. Roughly 10% is genetics. About 3 to 4% of that little genetics pie is about who you spend the most of your time with, which they'll say is who is your partner or who you're married to. So think about that. That plays a bigger piece of pie than some of your biological genetics. So we're really untangling that genetic piece. But think about that. 90% is in our control, and being able to better understand how we can use that information, how we get reliable information, and how we decide what we want to do with that. So from my perspective, and why I told you I come from the social gerontology realm, is brain health is for everyone. Doesn't matter if you have a health diagnosis, a chronic health diagnosis, a brain-related diagnosis, or any other factor. Those lifestyle factors we talked about can be of use to anyone. Everything we do matters to our brain. We just have to learn sometimes to keep our brain top of mind for decisions that we are making. And it's never too early or too late for us to start embracing a brain healthy habit. So if we think about what we're doing, this is ideally our goal. A simple picture. Everything we do leads to that brain reserve, helps us buy time for when we may have symptoms. And for many of us, we don't know if we will have symptoms. That's the goal. So over there's my picture of what a bad brain looks like. I'm going to let you decide what's in his cup. I think it's gone a few ways in presentations I've done before. But essentially, I hope this will encourage you to do good for your brain and all the things that you really can do in those lifestyle factors, and to help you remember health is many different things. It's our physical health, our mental health, our spiritual health, our occupational health. I think you get the idea. It's all those different facets that are us. It's our behavior. It's our habits. It's the way we live our life and our choices. And we can start making small little shifts to have meaningful change across our lifetime. And really, we get to leverage neuroscience to do this in many different ways. And it is for all of us. I'll repeat that again. It's for all of us. That's my main takeaway for everyone here. And I hope you won't have that bad brain, but I like to say all things in moderation, but to point out, he's what we call the SAD. He's the standard American diet brain. If you were to drive through a fast food or maybe a pub, because I'm not sure that's a Coca-Cola in his cup there. If it is, their seltzer thing is off a little bit, but gives you the idea of what you want to avoid and have in moderation. So your road to your brain wellness journey is completely attainable. I like to show this as just a path of, we have some hallmark things to point out. At birth, yes, our brain is very robust. It develops very quickly, but if I go from birth to the 90s, our brain can still grow new neurons. And we can do it in the areas of the brain related to memory, our hippocampus. We have that. So that bottom road, we even have a group of people called the superagers that we study. And their brains perform like people 20 to 30 years younger than them. And we study them to figure out why. Typically, it's like to the things they do and how they live their lives. Studies still pending and still ongoing, so I'm excited to follow how that's going to come out. But I just want to point out how this road goes. If you look at 25, that is when our brain aging starts. So when I teach college undergrad students, I tell them to enjoy it because they're at their peak. The rest of it all starts to decline slowly, and it just depends on the function of the brain we're talking about. And a lot of this we don't really notice. When we get to our 30s is the point I want to stop at for a moment. We talk about early onset Alzheimer's disease around age 60 to 65. We say the changes in the brain can start 20 to 30 years earlier, which would take our brain health conversation and our lifestyle factors back to our 30s. So when I keep saying brain health and everything is for everybody, if you're following this road, you could see how it is really for everybody. We have some changes that happen, nothing very dramatic that we haven't seen, where lifestyle, the things that we're doing and the way that we're living our lives doesn't have an impact. There are some different changes. Menopause for women does cause some changes for the brain. Some differences to point out. There are some gender differences of when brains for males and females reach full size, as well as complete development, but they're just differences that we have. And when we end at that road is cognitive decline is not inevitable. So I hope this just leaves you with a notion to make your brain health a priority and not an option. And I know from many people that have been in this group, I just want to point out, there is a current advocacy call to make Alzheimer's prevention goal part of our government initiative. This is from Us Against Alzheimer's. So if some of the things I've discussed today resonate with you, your organization, or the work, you can sign up to support this call to action. The last I checked, I believe there's over 200 signatures that include organizations as well as individuals that is calling on the US government to say, let's make prevention and our risk for Alzheimer's disease and risk reduction a priority. And let's make the promotion of brain health at the forefront of some of our national calls and priorities, because then we can get funding behind it. And what the ultimate push is that brain health becomes part of our healthcare conversations for people of many ages. Right now, it tends to happen when people get a diagnosis, if it's even part of that diagnosis conversation. We need brain health to be part of everyone's healthcare conversations, but we need a place to start. And the national call and effort is usually the first way to go. If this resonates with you, feel free to check them out and sign on to that. And if you are looking for any way to support your brain health and wellness journey for someone you care for, or really anyone, and you want to learn more, Brain Awareness Week is coming up. This is a global celebration of the brain. Our virtual Brain Health Center is offering 20 different classes. We've partnered with industry professionals here in the US, even a couple overseas, to just bring information and make it accessible to people about a variety of different aspects related to brain health. Information is available on our website, virtualbrainhealthcenter.com, but open invitation to anyone with an interest to learn about the brain. And I want to leave time for questions from anybody.
Thank you, Dr. Culler. If you could stop sharing your screen if possible.
That I can do.
Perfect. While everybody's trying to get their brain wrapped around what just happened, see what I did there? I do have a question in the chat that was early on, and it was a question about what about diet? In similar seminar, a doctor talked about the role of diet. Apparently there is a diet for the mind, combination of DASH and Mediterranean diets, and a book of that title by Dr. Martha Claire Morris.
Oh yes, there are multiple books published on brain foods and the diets. I use diet loosely because finding one that works for everyone is difficult. For your chronic health conditions and dietary needs for individuals. I also not a dietitian or nutritionist, but from what I have read in the brain health field, it is very important to nourish our bodies properly as well as our brains. Our brain does have some different dietary needs. It takes a lot of nutrition and a lot of healthy fats. The diets that are most common, there is the DASH, the combination of the DASH and Mediterranean, which is the MIND diet. The most common one that people tend to also then research is the Mediterranean diet. It has been ranked by the US News Report as the top diet in the US, I believe, as the last 3 years. It has also been found to be adhered to by the areas of the world where people live the longest. The blue zones is the Mediterranean diet. It is less restrictive than the MIND diet, which is one of the reasons I think people are able to adhere to it a little bit better. There are a lot of synergies in between the two diets of eating leafy greens, staying hydrated, less red meats, more healthy fats. But with the Mediterranean diet, you can still have some sweets and some wine. And the Mediterranean diet does incorporate a lifestyle. So it does involve the idea that there is socialization, there is movement. It's a little bit more encompassing of that as well. But yes, both of them are on there. And there's a couple different books about brain foods and healthy eating for that. But typically it's the plant slant, slanting towards more healthy fruits and vegetables, rich leafy greens, healthy fats and lean proteins, not American-sized steaks. If you have been to Europe, you're going to eat like a European in terms of your meat consumption and those types of things, as well as staying hydrated.
I hope that answered your question, Nanette, that asked that. And then Robin Toll confirmed that the packs of cigarettes are actually 20, which is even worse. So that means you're almost to a full pack. That's really bad. Does anybody else have any other questions they'd like to ask Dr. Culler? You do have an expert right here at your midst. And just a reminder, those of you that are on the phone, I know 2 of you have already emailed me, but if you could please email me again that you attended and your number that you're calling from, that would be amazing. Like I said, I have 2 of you, but I don't know who the other one is. So please, if you're on the phone, please email me that you're here and what number you called in on. I would greatly appreciate it. Does nobody has any questions, or is your brain just overfilled with a lot of information in 30 minutes? Okay. Wow. Okay. Well, Dr. Culler, you must have hit every thought that came into their brain. I don't know how many brain puns I can make today, but hopefully that's it for now. I'm going to stop recording, and maybe